Hello everyone, my name is Aleko Petrides and today I will be presenting about the pinch grip. So for a quick overview of how this lecture will play out, I will discuss what the pinch grip test is used for, types of diagnoses it can help diagnose, and the different types of devices. I will then discuss the research, show a quick video on how to properly perform the test, and then finish off with a live demonstration and answer any seething questions the audience may have. The goals of the presentation are to understand the uses, become exposed to the different types of devices and different types of pinch grips, learn how to properly perform the test, understand some statistical terms to be able to interpret research results, and finally be able to implement your own clinical decision making into whether or not, if and when you'd want to perform the test. So what are the uses of the pinch grip? They obviously allow us to assess strength of pinch. It gives us an objective measure of strength which can easily be documented to show progression. And it can also provide info on nerve integrity and help diagnose different pathologies such as de Quervain's tenosynovitis. There are multiple types of pinch grips that we use in our everyday life. We have the tripod grip. This grip can be utilized when buttoning one's shirt or holding a pen or pencil. The key pinch can be used to do exactly what it describes, turning a key. The tip pinch can be used to pick up small objects. And the palmar grip can be used for opening clothespins. My first article is titled Inter-Instrument Reliability of Pinch Strength Scores. The purpose of the study was to determine reliability of key tripod pinch scores in subjects with and without hand pathology when tested on 3 different pinch devices. The 3 devices are shown here. From left to right we have the BL, JTEC, and NK pinch gauges. 2 therapists performed the test. One performed testing on manual gauge and the other performed them with the computerized devices. 3 trials of maximal pinch strength were tested for both key and tripod pinches. The intra-class correlation for patient group and control group was greater than 0.90 and 0.80 respectively. ICC is simply how reliable a test is. The closer the numbers are to 1, the more reliable the test. Reliability is how consistent the results are. This is not to be confused with validity, which is how accurate the test is in measuring what the tester wants to actually measure. The results for this study showed that all 3 of these devices can be used interchangeably. It is important to understand that elbow and forearm position have an effect on pinch strength. It has been shown that having the elbow flexed to 90 degrees and the uninvolved fingers flexed allows for the maximal pinch strength. It is important to keep in mind when comparing scores. The purpose of this study was to evaluate the test-retest reliability and validity of the pinch and thumb strength with patients diagnosed with de Quervain's disease. De Quervain's is tenosynovitis of the abductor pollicis longus and extensor pollicis brevis. To get test-retest reliability, patients were evaluated in 2 sessions on the same day. Validity was determined by testing the hypothesis that pinch and thumb strength on the symptomatic side will be lower than asymptomatic side using the palmar grip. The study showed that the pinch and thumb strength on the symptomatic side in fact were lower than the asymptomatic side, pinch strength having the largest significance. Pinch strength was significantly decreased on the symptomatic side with a p-value of 0.03. The p-value is defined as the probability of finding the observed or more extreme results when the null hypothesis of a study question is true. A p-value of less than 0.05 indicates that there is strong evidence to reject the null hypothesis. The null hypothesis saying that there is no significant difference between specified populations and any observed difference being due to sampling or experimental error. For future studies, they may want to focus on how well the previously talked about instruments are at detecting change in strength over the course of treatment. Also, I could not find much about how sensitive or specific these pinch grips were at detecting pathologies. Sensitivity is the ability of a test to correctly identify those with the disease, true positive, where test specificity is the ability of the test to correctly identify those without the disease, true negative. Therefore, future studies should also include research on how accurate these tests are at ruling in or out hand pathologies. To conclude, I believe the manual pinch grip gauges are a reliable tool to document pinch grip. One must keep in mind the positioning of the elbow, wrist, and fingers when performing the technique to make sure the data is consistent and reliable. Here are my references. Now for the video. For the video, I will be showing a lateral and bird's eye view of the 3 pinch grips, the tripod, key grip, and tip grip. For each of the grips, you want the elbow flexed to 90 degrees and wrist in slight extension. The thumb and finger placement will vary depending on the type of grip. So first up, we have the tripod pinch. For this one, you want to use the thumb, index, and middle fingers. Here's a bird's eye view. Next, we have the key grip. For this one, you want the pad of the thumb to be placed against the middle radial aspect of the index finger, like you're holding a key. And last, we have the tip grip. For this one, you only want to use the tips of the thumb and index finger. Here's the bird's eye view. Here are my questions. Thank you very much.